I'm Sarah. I'm the VP of Practice Success and Innovation here at Vensa. I've worked here at Vensa for almost 2 years, and in a previous life as a registered nurse for a decade. And what I do with the team here now is I've got the honor to work with 600 general practices and clinics across the country, as well as primary health organizations and district health boards. We supply better access and more timely patient communications, as well as access to healthcare services and co-designing the health technologies for the future. So I think men play a huge part in developing great teams and also the future of young female healthcare professionals and health into the technology space, and that's because I come from experience in that. Have had a lot of male mentors throughout my career, and it's just within that diversity as a team that we create the most productive and strongest teams. So both gender diversity as well as cultural diversity. The best advice that I've received from my mentor is from Jabaway, which you'll see his interview, and he always says, live in your uncomfortable zone. And I think that's really important because that's where the magic happens. So it's about exploring situations that put you into that uncomfortable zone, because then you know you're on the right path. So there's been a few challenges in kind of the journey. One, as a registered nurse, tends to be this hierarchical and culture within that still is predominant in our healthcare systems. We know, and evidence points that coming from a patient or client-centered approach with a multidisciplinary wraparound team actually leads to the best health outcomes. However, we still haven't made that shift through the healthcare system as of yet. And kind of also the second challenge was with taking my master's. There is this predominant kind of poor support for young nurses and healthcare professionals to continue their education, and kind of fighting for that and continue fighting for that for the next generation of nurses coming through. And then now my current challenges is there's a lot of fragmentation in the healthcare market, and that's not a technology problem, it's a people problem. And a lot of those problems are around interoperability of systems, and also not taking a consumer or patient-centric approach. I think more exposure to kind of what's around there in this health tech space, getting the word out, inspiring creativity in the next generation of amazing young minds, getting them on board and thinking outside of the box and pushing those uncomfortable zones. And then also just that mentorship. So we're kind of taking on the next generation and being good mentors. 3 points of advice I think would be to be confident in your authority as a woman and the uniqueness that you bring to a team and an organization. 2 is to always be genuine and come from a place of comfort in yourself, but to continue to explore the world and push yourself in that uncomfortable zone. And then the last piece of advice is doing the same thing and expecting a different result is the definition of chaos. So always be agile and always iterate.